if we look at the labs and your magnesium is really low, or if you have low ferritin, which is your iron stores, no amount of cardio is going to fix that. Like, we have to be able to improve your iron stores, figure out why your iron is low, and also look at your magnesium, replace that. And then you're going to feel better.
Jessica Raymond, welcome to the Alloy Personal Training Business Podcast.
Awesome. Thanks for having me. Excited
of course. Yeah, so excited to have you. So before we get started, people are going to wonder who you are. So I've got some basic information that I'm going to go through, and feel free to add. Does that sound good?
Perfect.
And for anybody listening, I'm super stoked to have Jessica on. I love her background, and we're going to talk all about Marek Health, and she's got a ton of expertise in this area, some of it very specific to our client avatar. So without further ado, you are a nurse practitioner. You've been one for the last 15 years. Is that correct?
So before a nurse practitioner, you're always a nurse beforehand. So I was a RN. I worked in emergency departments. So I got a lot of experience there. And then I've been a nurse practitioner for the past almost 8 years now.
Okay, cool. Yeah, my daughter's a cardiac ICU nurse. So I certainly understand that world prior to nurse practitioner for sure.
Oh, yeah. It really gets you prepared for it.
Yeah. And you worked in trauma center in the hospital. Is that correct?
Yep, 2 trauma centers. So, I mean, in a bigger city here. And so you would have, gunshot wounds coming in, someone with a toenail problem, next, or like someone having a baby. So it was like, you really had to really be able to handle high level situations pretty quickly. So gained a lot of skills and knowledge there and loved it. But after the ER, I went to more of hospital medicine. So I worked in hospital medicine as a nurse practitioner for acute care for about 8 years, and then transitioned more towards opening up my own office and working with Marek.
Yeah, I love it. So Live One Health and Wellness, right, which is concierge medicine in your local hometown. And I love the fact that, and we've seen this from a lot of medical professionals that are buying into Alloy. We have more physicians coming to the table, and they're like, I'm tired of treating sick people. I want to get in on the front end of this, problem or challenge, right? Is that kind of where you are as well?
Oh, 100%. I mean, when you work in the hospital setting, your general population is going to be like 50, 60, 70, 80-year-old clients, right? So you see them in the hospital. And even in the ER, you see young people, 40, 50, they have a heart attack, they're having stroke, they're obese, they're like elderly with dementia in the hallways. And like, my thing was like, how do I not end up that way? How do I not end up that way? And whenever I was in the hospital setting, I would treat them, and I could treat them, make them feel better, but they were coming back like in the next, month or so, and they weren't any better. I didn't feel like I was doing enough. And so it really got me going on the more proactive side of things, where like, how do we prevent this from happening?
Yes.
And it's really kind of that same concept of like healthcare 2.0 that Dr. Peter Attia refers to. Is healthcare 2.0 is going to be that reactive approach. And hospital medicine, everything is great for that. You have a problem, you're going to go, they're going to fix it. But really, the healthcare 3.0, which that's where medicine, I hope and I believe, is trending more towards, is that preventative approach, where how do we look at your lab work? How do we look at your lifestyle and optimize it as early as possible to reduce your risk of like stroke and heart attack and vascular disease, which is ASCVD, which is the number one killer of people globally. And 90% of its risk factors are modifiable, meaning you could reduce your risk of that like throughout your lifespan by decreasing your high blood pressure and also high cholesterol. So it really led me down this rabbit hole of like proactive approach, preventative medicine. And like, I really found that with Marek Health and being able to provide this type of service to people all over the country. It's been amazing to do that.
Yeah, I love it. And of course, that's where we want to go as a brand as well. I've been in business since 92, which is a really long time. But, we're trying to get ahead of it too. And following that same prescription, we talked a little bit before we started the podcast. It's like strength training, your zone 2 cardio, like all those things. And you guys align perfectly with that, which we love. Now, beyond that, obviously, you're a Marek provider, which we'll talk about that more, what that means. I thought this was super interesting. So you're a certified menopause practitioner. So what is that exactly? I mean, I think I know, but I think people would love to hear.
Yeah. So North American Menopause Society offers a certification for providers to become certified as menopause provider. And I really like working with Marek Health. We work with a ton of like female clients. And then also in my office here, we work with a lot of female clients going through, perimenopause, menopause, and just there's a lot of like kind of still a lot of fear kind of around like menopause and like, what do we do? What do we not do? What's going on? And so really being able to dive deep into that and gain a better understanding and knowledge base of that and to get a certification, just to show how like much, you can do with menopause therapy and treatments. There's a lot that can be done. There's a lot that should be done and it started earlier. So, like anything, like any, thing I dive into, we want to like learn as much as possible, as much as you can. So like that's where that came up from. But yeah, I was really excited to have that be able to accomplish that task.
Yeah, and that fits our customer avatar perfectly. And is menopause a real thing? Always, like guys have it too, kind of,
yeah,
right? Like, yeah, okay.
yeah, andropause. Yeah, I would say
andropause. That's
yeah,
what you call it.
andropause.
Okay, cool.
You're not going to get like a diagnosis of andropause, right? Like you're not going to find
I
ICD-10
want official diagnosis of andropause.
I know,
That
right?
sounds great. That way, if I'm having a bad day or someone's like, "Hey, you're really rude to me," I'm like, "Well, I'm an andropause." So
yeah, and just say it in a way that's confident, and they'll just take it from you. See what you can find, right? So,
yes. I'm really good at that, by the way.
Confidence and authority, and they'll agree.
That's
But
right.
yeah, so I would say, when we age, I mean, our hormones do drop down, and specifically like with testosterone, even for women with their testosterone, is super important for them as well. You're going to see that decline. And so if a lot of times, of course, with TRT, and I love testosterone replacement therapy as well. And men and younger men are really going on TRT, and not just to go on it for any type of like, they're not being bodybuilders when they come and see me. I mean, some of them are, but a huge majority of them are just guys that have low energy, low drive, low libido, like erection quality issues, can't put on muscle mass, poor recovery. And it really goes inside with females too, because they feel that same way as well. And a lot of times they come to me and they have these symptoms. They've already gone to their PCP and they kind of like, well, go eat more, go work out, or like, you're fine. Like, here's your SSRI, like it's probably anxiety. And like, and it's very defeated. And so when they come to me and we go through the labs and we talk about actual feasible options for them, they like just have hope. Like in my office here, I've had to like put a tissue box next to like the seats because people are like, oh my gosh, like I can actually like do something about this. I don't have to actually feel this way. And I was like, no, we don't have to do that. Like we're good. We're good to go. So it's very rewarding and it can be done for both men and women and it needs to be done. It really does.
No, totally agree. And then just on a personal note, you're also a figure athlete. So you actually practice what you preach, which is amazing. It's not always the case, right?
Yeah.
And then probably most importantly, you're a mom of an 8-year-old son.
Yeah,
is that correct?
He just turned 8. So, yeah. So, well, he turns 8 on the 20th, but we had his birthday party here recently. But 8-year-old son, I mean, I love being a boy mom and stuff. And he comes to the gym with me too. And it's really instilling those habits in like kids as young as possible, like prioritizing protein, being in the gym. And he was with me like when I did my figure competition last year too, and went to all my posing classes. So really like showing like the next generation how important like building protein into your diet is, building resistance training in. And of course, like when you do a figure show, you're kind of putting it to the extreme and everything, but just seeing that dedication, that discipline and pushing that through is something that I think is really great. I feel lucky to be able to instill that with him, even though he doesn't really listen to some things I do because I'm just,
he will. So my kids are grown and gone at this point, but they grew up, I started having kids at like 23. So like my kids grew up, with me owning gyms and they played sports. And so like, it was always part of their life. And what's funny is you don't really think they're absorbing it. Then later they do. Right. And so like my daughter's 24, the nurse, and she's gone through the whole Marek Health profile just to get a baseline. And I mean, they're super into it, it's really cool. Yeah. So anyway, all that being said, I love your background. So let's get into like Marek specifically. Right.
Yeah.
So again, this is part and parcel of like our launch with you guys. A lot of people are confused, like, hey, what do they do? Isn't it what you guys do? I'm like, no. This is a different thing. So what we do, but like at a really high level, like what is Marek Health and why was it created?
So with Marek Health, we really are bringing like this type of proactive health optimization approach to healthcare to like the masses, basically. So Marek Health partners with providers like myself, and they're these like interval between like bringing people in, getting them to their lab work, and then also once the lab work comes in, they can get us to their partner provider. So being able to bring this proactive approach to the masses and be able to talk to people and help them actually reach their highest potential is like the genesis of why this was really created. And it's just grown so much over the last couple of years. I've been with them for several years now, and it's just really cool to kind of see how they've grown and how many people we've been able to reach. And like, there's just a number of stories of people that have gone through the process, and we see how they've improved. And it's been amazing to be part of that transformation. And yeah, it's just great to be able to provide that to everybody, like across the whole country.
Yeah. So in its bare essence, like in my most rudimentary way to explain it, it's like concierge detailed blood work that would probably cost you a lot more money if you went to like a concierge doctor. Certainly in my market, I'm in Atlanta. But it's also telehealth. So like you're a provider for all 50 states. So like someone could have you as their Marek provider. They don't have to live in Michigan necessarily. And the access to detailed blood work with people on the back end that understand what we're looking for, it's so much different than going to, and not to throw shade to sort of like general practitioners, but a lot of them aren't trained to really, again, be on the optimal or the front end and to look at this detailed blood work and explain it. Exactly. And for anybody that's listening that's with Alloy or is considering, like, Marek is just a vendor partner of ours. Because they're like, are you guys doing this? Is the blood work happening in the facility? I'm like, no, hold on. We're just putting you guys in our vendor suite as a resource for franchisees and their clients to say, listen, why don't you do this? And we can shoot them a link and they land on the landing page and they're off and running to get this detailed blood work. And so I love it. I think it's great. And then the value is amazing, by the way, compared to maybe what you would pay, maybe not at your clinic, but like at some of the others.
Oh, for sure.
Let's talk about, sorry, go ahead.
No, I was gonna say, and it shows so much value that you have in your clients that you work with, being able to partner with somebody like Marek to really, it shows your investment in your client to connect with someone that really is going to look at their lab work and help them get to their level. So it's really looking at the client as a whole. So, I mean, it says a lot about you guys too. So that's really amazing that you guys reached out to us.
Yeah, well, thank you. And, again, we're growing like crazy. And so like, this is again, we always consider ourselves like this hub in the wheel, and there's all these spokes, and like the hub is the center, but there's nutrition and there's supplementation and there's, your hormones and all these spokes in this wheel that need to be addressed to really live your best life. Right. Sure. And you guys are definitely a big part of that now, which is awesome. So let's talk about like how it works, like mechanically. So just explain like, okay, someone engages with you guys. Let's just walk them through it. They get the script, they go to LabCorp, like just walk me through the process.
Yeah. So once you get the order for the lab work. So if you came in either through whatever direction you sent for your clients, they follow through that link, whatever it is, they go to LabCorp, and they can either go to LabCorp at certain locations in the country. They can have actually like a phlebotomist come to their home and draw their lab work in their home, which is super convenient. Like you can literally just like wake up and there's somebody at your door, draw your blood, and then you can do what you need to do. So there is that offer as well. Once your lab results come back, you are connected like with like a health coach too, just to kind of facilitate your direction into like the provider. The provider would look at the lab work. And really when you look at the lab work, I mean, everyone's probably had some sort of blood work done with their family doctor. But what we really do and we offer is more of a viewpoint of looking at the lab work from like the lens of health optimization. So when you go to like your family doctor, it really looks at the lab work in the sense of like disease treatment. And like, is something going on acutely that they need to fix, which is needed. It's very much so needed. The average amount of time somebody has to spend with a client in America is 7 minutes in like their family doctor's office. So that just doesn't provide enough time to really go through the labs. Like we can go through the labs with clients. So when we look at the lab work, when you come meet with me, I have all your labs ready. Like your connecting person, like your health coach or through Marek, has everything written up already for me to look at about your history, kind of your symptoms, your pain points, things like that. When you come in, we talk about like, what are you doing for diet? What are you doing for exercise? And just reinforcing what you guys are doing at Alloy there too. And which is great because usually when you guys come in, you guys do amazing jobs. So it's like, I don't really have to spend a lot of time on that because you guys do really, really well. But then we look at the lab work and kind of start from the top and to the bottom. We go over your thyroid health. We look at your regular CBC, your comprehensive. We look at your insulin level, see what your insulin resistance is. Look at your inflammation, which is like your CRP marker. Look at your hormones, of course. So like you're not just like your standard testosterone that usually just checked in the family doctor's office, but your testosterone, your free testosterone, estrogen, progesterone, estradiol, FHBG, all of the hormones, and then also looking at your cardiovascular markers, which are super, super important. And not just your lipid panel, but also like your lipoprotein little a, which is like a genetic marker that tells me if you have more destructive LDL. And then also your ApoB, which is the number of vehicles that drive the cholesterol to the arteries. So you're not just getting a provider that like is just looking at like, are you in the reference interval? Because the reference interval really is just a culmination of the average like results that lab received. And we don't want to be average. Like we want to be above
Right.
it, right?
Yeah, we
So we
always
don't want
joke
to be
about
average.
like go to the airport or go to Disney World and look around. It's like, is that your average? Is that what you want to
Yes.
be? It's like, no, right? You want
No.
optimal, right?
100%. So like we have our optimal ranges and everything that we look at, and then also try to like figure out how do we get there and how are the labs connected to help get us then to that optimal range. And so it's a really comprehensive like proactive approach to all the labs in ways that reinforce like, yes, you're doing great with your resistance training, you're doing great with your protein, this is where we need. Let's look at your insulin resistance a little bit here, that your hormones are off here maybe for whatever else reason. It doesn't mean like you come here, we give you hormones. Like there's a lot more beyond that too, is where like, so just because you get your lab work done doesn't mean like, I don't know if I really want to go at HRT. Well, just get your lab work done and we'll just kind of look through it and see, maybe you're off on magnesium, maybe you're off on vitamin D. Vitamin D is a hormone as well. So there's a ton of other constraints that we can look at in your lab work to pull the right tool or the right lever to be able to make you feel and perform much better. The outside approach is really the exercise and training and diet and things too, the outside in approach, but the inside out approach is your lab work. And sometimes that's where your constraint is that we need to fix so you can actually perform better and recover.
Yeah. So again, just to reiterate, we have a landing page through Alloy where they can go directly to Marek. If you're not with Alloy, you're just listening to the podcast. You get your, prescription to go to any local LabCorp. You get your blood work done. It goes in a couple of weeks later. You get your results. You jump on the phone with like a Marek coach. They walk you through your blood work. Then you can make the decision. Yes, I'd like to meet with a Marek provider. They could then get on with someone like you, go back through the blood work in more detail, and then discuss remedies, right? And there's always some like big rocks to hit. And then there's some maybe nice to haves, if you want on the back end. And the thing I appreciated was like, hey, what are you going through now? I'm like, well, I'm kind of stressed. I'm growing this company really fast. My sleep's not great. It's like, oh, we could adjust this or we could adjust that. It was very specific to me. It wasn't just a generalization of like, oh, you're in the normal range. It was like, how do you feel? Right. That's a different conversation. Right. And then I met with a provider, and then I chose like, okay, this is a course of action I want to take. And then you pay for the labs or the prescriptions or whatever those are. And then they come from a national compounding pharmacy and they just show up at your door. So it's like, it couldn't be more convenient and seamless.
Oh, completely. Especially for the busy person. Like I just had like, they can do their telemedicine consults, like in between their meetings at their office, like they can just kind of pop in real quick. They don't have to leave. And that's so convenient for people that are just very productive. And they just get a shipment to their door. They get their whatever they need. Like it just literally is shipped to them. And I think that's just the way it needs to go with how busy everybody is right now.
Right. And then blood work is done again every 6 months or so, right? Just depending on the situation.
So I would say in general, like just for health optimization purposes, I would at least get blood work done every 6 months. A year maybe, but I would say 6 months if you really want to stay on top of everything. If somebody was to say start testosterone therapy, so if someone went on TRT and we would want to do their blood work again about an 8-week mark, because I'd want to see how their levels are doing, how they're tolerating it. And then if they started thyroid too, we want to check thyroid medication or thyroid levels at about 8 weeks as well. So really initially, sometimes you have a little bit extra lab draws just to kind of really tailor in your dosing a little bit further. But I would say after you kind of get through that, it would at least be every 6 months.
Yeah, and for anyone listening, to your point earlier, and this is really important to me, this isn't one of these like testosterone clinics where like everybody gets, prescribed the same thing. It's not that way at all. And I've actually heard stories of people that did lab work with you guys. They get on the call and the lab work looks good. And they're like, how do you feel? They're like, I feel great. They're like, great. Now you have a baseline, right? It doesn't always result in the common stigma of like everybody goes on testosterone or everybody goes on hormones of some sort. It's not even that. And that part I really appreciate about you guys. Do you see that often as well? I mean, obviously there's some protocols there, but sometimes you're perfectly fine.
Oh, for sure. And I think a lot of things are like, since testosterone is so popular, everyone's like, is my testosterone? And I'm like, well, your testosterone, your free testosterone look pretty good. But a lot of times it's the hypogonadal symptoms that somebody can experience they're very subjective. And they really can be correlated with also like thyroid issues? And then also like, did you really like, are you sleeping okay? Like what's going on? How's your stressors going? Because it can significantly impact your levels. So even if somebody came in and they had a little bit lower testosterone levels, a lot of times I'm going to say, okay, so let's really try to pull every lever we can to try to optimize your testosterone before we think like, let's even go on testosterone. That's a lifelong therapy. So we really like, I talk a lot of people out of wanting to go on testosterone therapy, because it is a lifelong therapy. And if they actually don't need it, I don't think that they need to like spend the money and be on it for forever. If they need it, of course, I really want them to be on it. I'm going to advocate for it and be able to make sure it's done safely. Same thing with HRT therapy for like females for menopause. More so menopause women more so really need estrogen, progesterone, maybe testosterone therapy because there's just nothing there. Men still produce testosterone. They just need to replace. But, women are kind of basically almost castrated when they go through menopause. So they need their hormones replaced as long as it's safe. But yeah, I mean, everyone's very individual and we really take an individualized approach. It's not like, oh, here's your testosterone, you're an asustrozole, and, here you go. We'll see you in a year and we'll just send your scripts. That doesn't even fly at all here. You don't even get that, that's
right.
So it's very, very tailored, very, it's very like set on when we need to do our lab work done. And if we have any issues, you reach out to us. Like we're available to you guys too. It's not just like, hey, we'll see you in 6 months. It's like, if you needed something in the interval, we're there too to answer questions or make adjustments if we need to.
Love it. So like in your professional opinion, which I guess that's all you're going to give me. Don't give me your unprofessional opinion. In your opinion, what's the value in getting regular detailed blood work like this?
When you're able to get regular detailed blood work, you can almost build your own like reference interval as well. So, like, hey, I felt really good here. This is what was going on in my life. These are how my levels looked. And so you can kind of build your own reference interval. And really also when you look at your labs, that's only one snapshot in time. So when you're actually getting a good number of labs in a row, you really start seeing a trend. As a provider, I want to see how your labs are trending versus like, oh, hey, this level is just low at this time, but there's so many variables can affect it. So if somebody had like a heavy leg day or something like the day before their labs, or they worked out right before very heavily, I'm going to see an elevated AST and ALT likely if they train pretty hard. And so if you see that, sometimes you're like, well, we're going to have an issue with the liver, but really it was because of training. So if I see that did come down, I can more likely say, hey, it was probably more of the training, or I can look at a GGT or something and I can see that. But I'd rather see a trend. So you can build trends. You can like build your own reference interval. You can kind of see where a lot of times I'll get guys later 30s, 40s, definitely into the 50s. And they just say, the last 5 years, I just feel like my engine's gone down quite a bit. Like I'm not revving up like that, right? And it's just, something's off. And I've gained a little bit of weight. I can't lose it like I can. My erection quality is not that great. And so if they had reference intervals, I always ask them, have you had testosterone check before? So it kind of gives me a reference interval back as well. So I can kind of look back and kind of do that comparison. That's really beneficial. Also looking at cardiovascular markers, like looking at your ApoB, which is a very, very sensitive marker, very good marker to look at your cardiovascular health. We can see if you had lifelong exposure to high apolipoprotein B and you actually had protein little a, then we know early on that you're at a higher risk of cardiovascular disease. So we can see that trending down, or if we're noticing that starting to come up, then we need something's going on here. What's happening? So it's really like, it's a tool to be able to kind of trend and see and catch things early before they cause issues. And then, it can really tailor like your supplement protocol and everything too.
Yeah, I love it. I think it's just really smart. I mean, how else do you really know? I mean, I saw like on your clinical page, you guys use the InBody. We do as well. We've got ways to tangibly measure how people move. There's just so many things that go into it. But like you said, the inside out versus the outside in approach, obviously, having you guys from the inside out approach, then you treat all of it, right? If you really want to live your best life. I mean, look, our brand promise is like looking good because everybody wants to look good, whatever that means, right? Feeling great has a lot to do with, like you said, like just overall energy. How do you approach the world? And then lastly, it's looking good, feeling great, living life to the fullest. And part of living life to the fullest is being able to optimize your health, right? At any given stage, because your lifespan is one thing, your health span is another thing. And a friend of mine that's in the supplement industry, he uses another term called your play span. which is basically like how long in your living years can you do the things that you really enjoy, right? Whether it be golfing or hiking or whatever it is that you want to do, right? And I think that's the most important thing. If you told someone you could live to 120 years old, but the last 30 years of your life you're bedridden, it's like nobody wants that, right? So it's a different marker than maybe what you see on the tail end of medicine, maybe where you started, right? Treating sick people.
Oh yeah, that was just like, it was almost horrifying sometimes just to see these people and they break a hip. Like they're like, that's the biggest thing I see with females is like when they're over 65, one of the biggest risks of death and like debility is a hip fracture. It's almost worse than getting a metastatic stage 4 cancer diagnosis in the terms of death rates. So over the age of 65, they fall and they break their hip. Then they go to the nursing home and then they get pneumonia and they come back in and they have a bladder infection. And it's just at the age of 65,
just
that's
cascades into all types of stuff, right?
Downhill, and really focusing on muscle mass reserve, focusing on that protein intake, because as you get closer to menopause, you need a higher stimulus of higher protein. You need more resistance training, like lift heavier weights actually with proper form, but also good proper form technique and protein intake. And then also considering that HRT, so you can continue to stimulate that bone mineral density and maintain that, as long as you possibly can. So it really all goes hand in hand together. With training, a lot of times it could be like, I get really winded doing certain activities. Maybe I need to like improve my cardiovascular health. But really, if we look at the labs and your magnesium is really low, or if you have low ferritin, which is your iron stores, no amount of cardio is going to fix that. Like we have to be able to improve your iron stores, figure out why your iron is low, and also look at your magnesium, replace that. And then you're going to feel better. Like it's really just goes hand in hand.
Right. And so many of those things are so easily remedied and are very inexpensive. It's like but you don't know until you know, right? Because then you're just at a loss. You're like, why is my energy low or whatever? So I love it. Let's talk about the traditional Alloy customer avatar, which is, again, pre-recording, we talked about it. That's a lot of the patient, population that you see. Our sort of sweet spot is 45 to 65. And that is a pivotal time for these sort of changes that are going on in your body. What do you see, if you can speak to like, what are the common deficiencies that you see? I know it's hard to say that because like everybody's an individual. That's what Marek's about. That's what Alloy's about. But like, if you had to say, these are the top 3 things that we see, either male or female, do you have anything like that you could share?
I think the beginning of their life really depends on how they first started out in their 20, 30, and 40s. Like if they lived a really good optimal 20, 30, and 40s, then when I get their labs in their 40, 50, and 60s, I would say the top 3 things that are off generally is for men would be like their testosterone levels. Usually like a magnesium could be off, vitamin D, like those simple things. Those things are usually off generally, and their thyroid might be taking a hit a little bit. Insulin resistance. So it really goes hand in hand with insulin resistance, testosterone, and also somewhat thyroid, but I wouldn't say thyroid all the time. Sometimes it's there. But if they lived a really good, like 20, 30, 40s, they prioritize health at that time. I don't see as many markers that are off, but generally more so like testosterone can be off. If they really didn't prioritize their health and wellness early on their 20, 30, and 40s, when I get their labs in their 40, 50, and 60s, it's everything. Insulin resistance is through the roof. And when I say insulin resistance, it's such a popular term, but insulin is just like the key that helps take the glucose into the cell to utilize it as energy. And if there's fat like into like the muscle tissue, or if there's just genetic in nature or just a poor lifestyle, the beta cells in the pancreas have to produce more insulin and bring that glucose into the cell to utilize it as energy. And that insulin really messes up so much other factors. So insulin resistance, they have high cardiovascular markers. Their testosterone level is plummeted. And it's not that their testosterone level is plummeted because they are going through like andropause or like it's coming down. It's that they have such a poor metabolic health that their body's like, we are shutting down this testosterone. So if we can help improve that metabolic health, we can actually help that testosterone levels come back up. And really they'll come in and have erectile dysfunction issues. But really one of the first signs of like cardiovascular disease is like erectile dysfunction because of the vessels in the penile tissue that actually bring in the blood flow there. And really, it's not the testosterone. It's really more so that you have cardiovascular health issues going on.
And same thing with women, right? There's probably some parallel, like.
Yeah. Oh, for sure. And like, so when women come in and they maybe have a low reserve of muscle mass or anything and they gain weight, it's not that their hormones have completely dropped off as well. It's that they kind of slowly gain this weight over time and they didn't kind of keep it as much of a priority. But sometimes it's different. Sometimes like other women have a little bit, they just lose their hormones and they gain weight or have inflammation. But women, of course, like the average age of menopause is 51 to 52. And so like they're going to have very low estrogen, very low testosterone, very low progesterone because they're not making, an egg anymore. So that's what I see mostly low there too. Same thing with the insulin and cardiovascular health and everything. But after the age of 50, 51, if they go through menopause, that's just not going to be there if they're not on HRT.
Let's talk about that for a minute, just hormones. And I know that, I mentioned like the last podcast I did with Rami, who's, he's a health coach and he uses you guys. He's affiliated with you guys. We met for coffee probably 6 or 7 years ago, and I was just presenting and we were just talking, and I was traveling all over the world at the time. We used to do a licensing. We had like 2,500 door fronts that we service from India to Dubai and everything. And so I'd gone from like just hanging out in the gym to like I'm traveling all over the world for 15 years. And there's certainly some habits that go with that aren't ideal. But even with that, towards the end, I told him, I'm like, man, I just like my drive is low. I didn't have any sexual dysfunction. I was just like, ugh, I just felt like blah. I couldn't figure it out. He's like, oh, you need to get your testosterone checked. And of course, my immediate knee jerk was like, oh, no, because like, again, there's this weird stigma that I had attached to it, which I think other people do as well, where it's like seen as like, I joked with him like, oh, you're cheating at baseball, like the whole Barry Bonds and all that stuff. It's like, and it's not that at all. So what can you say about either men or women? And there's also, and I'm taking a step back here, but I remember listening to Peter Attia saying there was such a disservice done to women by one faulty study that showed that like hormone replacement was somehow causal, in breast cancer cases. And it turns out it was like a faulty study, but it was so much fear mongering around it that it stuck. And so everyone's like, oh, you can't do hormones because that's going to give me breast cancer. Which turned out to be a flawed study in the first place. So
hugely.
What can you say about like men and or women or both? Like what is the stigma around hormone therapy? And how can we, what would you say to someone who is fearful of looking at something like that?
Yeah. So the WHI study was definitely kind of a disservice and everything. There was some good data that maybe came from it, but definitely put a halt on a lot of women that could have really benefited from HRT and still have issues with maybe going on it. The stigma, I think, like for men with going on TRT, people, when they think of testosterone, they think of like big bodybuilders. But testosterone, I mean, we all have testosterone. Women have more testosterone in the body than estrogen if you look at the units, if you equivalate that. So when you think of like replacing hormones, like no one says anything about replacing thyroid hormones. Like if your thyroid's not working, it's an organ that's not working, you replace thyroid. Like no one says anything about that. But if you look at the sex hormones, like the testosterone, estrogen, progesterone, and those need to be replaced. You're getting them to actual optimal levels. You're not going extra physiologic. So when you do bodybuilding or anything like that, you're going extra physiological levels because you have a different goal than someone else who maybe has longevity in mind. So the stigma around it kind of comes from, I think, more so the fear of like developing breast cancer and everything else that can correspond. And also for the testosterone, I think it's more of like, am I cheating because I'm going on TRT? When really you're just replacing what you normally would have had anyways. So it is something that I think we're still working on. There's a lot more education getting out there. And it's really like listening to reputable people like Peter Attia and asking questions and kind of like questioning the norm of how it's been, because you don't have to feel like the vasomotor symptoms that women go through. And then usually are told you just have to suffer through it and you're fine, when you really don't have to do that. You can go on HRT. You can get mammograms. You can get testing done. Like you can do like your pap smear and stuff just to monitor and everything that you're doing well. If you have a higher risk in your family history of breast cancer or other female cancers, then yes, we have to consider that. Maybe you're not a candidate. And really that's okay too. If you're not a candidate, that's okay. It's not like I'm doomed for dementia and everything else. If you cannot take like HRT as females, I think I get that too, is like, now I feel like, well, I can't take estrogen, then what am I going to do? You can still like really prioritize your protein intake, your resistance training, and really put yourself towards that and still try to live an optimal life. Yes, maybe HRT maybe have been better for you to go on, but that wasn't the cards you were dealt. So you just maximize whatever you can possibly outside of that. But I think the stigma is going to hopefully kind of come down as more people are educated and this becomes more of like a proactive approach versus the preventative medicine. And it's still, a lot of it comes from their family doctors, because I'll have a lot of clients in my office and I want to like instill with Marek, like we want our clients to still have a PCP. Like we still want them to have somebody for acute issues. And a lot of times they'll go and talk with them and be like, well, I don't think you'll benefit from HRT. And it's still, even the providers are still not quite there yet. So I think it's just going to take some time. And then it's just the education. And once we put people on the appropriate HRT and testosterone, they feel amazing. And they're like, I don't care what the risk is. I'm going to stay on this. Like we do.
Right.
So we're going to watch it, but also they just feel amazing. And then it just changes their life and their relationships, and they feel so much better.
Yeah. When I had, again, Rami on the podcast that I think came out today, but he said the same thing. He's like, there's enough info out there. Like really at this point in time, if you still have those stigmas, that's kind of on you, because if you just do a little bit of research, you'll find.
Very good point.
Yeah. And he also used similar to your analogy. He's like, listen, attaching a negative stigma to it would be like doing it for like diabetes. It's like, okay, so my pancreas doesn't produce insulin, so I have to take it. We don't shame that. So what's the difference here, right? And so a lot of it, to your point, is just education, but the information's out there these days. So it's not hard to find, right? So you're just probably getting poor influence, or maybe you're stuck to something you read, 15 years ago that's just not relevant anymore. Would you agree?
100%. And really, we like to meet the client halfway too, in the sense of like, if they're still worried about it or anything, we also would provide like, these are some resources or some good sources. I always like to do that, like in my consults with clients, is like, if they're still a little bit hesitant, I'll say like, I want to be able to provide them with a resource that they can actually go to and it's reputable. So it's sometimes you have to like, okay, if we're not ready at this time, we just open the conversation and talk about it and say, here's some more information that you can review. You can talk to your family doctor about if you want, and then come back and we'll chat about it again. Like I'm not in a rush. If you're more than 10 years out from like your last menstrual period though, then that's too far out. But if you're right within that range, like early on, or right in like menopause, then, we have a little bit of time to kind of make some discussion, because I want you to feel comfortable with it. Because if someone goes on therapy, especially like testosterone therapy too, or HRT for females, I want them to feel comfortable and confident in what they're doing, and not have this like kind of like issue in the back of their mind, like, should I be on this or not? I'd rather like give them the time to build them the confidence to go on HRT or not. I want it to be their decision as well, a collaborative decision to go on that.
Yeah, no, I think it's great. I mean, again, that's why we love you guys, because that approach is ideal. It's rational, right? There is a human element to it, which is why I love, like on the consult that I went through, it's like, how do you feel, right? That's so different than you're fine, or like, yeah, you're normal, you're going to be just fine. Like you're supposed to feel that way. You're 55. It's like, well, what does that mean? Like, I just turned 54. Like I feel great. I have single digit body fat. I'm strong. I don't have any joint pain necessarily. I feel great. And I hate to see someone that would be in my age bracket who is somehow scared to treat it, right? Yeah. Because they got some misinformation from, again, a family doctor. I feel like we're killing family doctors. We're not. I'm just saying it's not necessarily they're treating acute, sickness, and that's needed, because if you have it, you need them, right? But
for sure,
if you can prevent it, even better.
Yeah.
Right.
And really the insurance really kind of constrains them to like certain number of what they can order, what they can do, like how many people they have to see. And so it's really not that they're like waiting for a check in the mail for like prescribing all these medications. They just don't have time to actually see them because they're so constrained. And so I was so lucky to be able to kind of pull myself out of that type of medicine. And I really think there's a lot of value to what they do, because really like at my office here too, and at Marek, I really want to like bridge the gap between modern medicine, which has a ton of benefits. Like if you need cholesterol medication, you need blood pressure medication, we know we have great tools for that. But also like here's some more alternative approaches that maybe can help on this realm too, and just kind of bridge that gap between, more of that modern and functional medicine, and kind of be right in the middle and be that proactive approach. But it's definitely really needed. And I really think that's the direction that it's going in.
Yeah, absolutely. That's why we're so excited to partner with you guys. We want to be that as a brand. You guys are that. It's like a perfect marriage. We love it. Well, listen, I know we're like, this will come out in a couple of weeks, but we're, for those that are listening, it's like the day before Thanksgiving. You have a family. I'm sure you're really busy. We appreciate you having us, having you on. I'm going to put links to all of your website or whatnot. But for people that aren't going to look at it and they're just listening, how would someone, if they want to learn more about you, if you want to learn more about Marek and you're with Alloy, go to the vendor portal. There's a link there that takes you to the Alloy landing page. But if somebody wants to just learn more about you or connect with you, where would they find you?
Yeah, so I through Instagram, jessnp.live1. I have Live One Health and Wellness, or live1health.com is my office here in Michigan. But through Marek, if you go through Marek too, you can request me as well through them. And I'd love to be a provider. So yeah, excited. Thank you for having me on today.
Oh, it was amazing. So listen, thank you so much for spending the time and helping explain Marek. And we're so excited to partner with you guys. And I'm excited that you're a provider. I'm sorry I didn't get to work with you. I like the person I was with, but you would have been awesome as well. But anyway,
Good.
Jessica Raymond, ladies and gentlemen,
team.
thank you.
Thank you.